We are having one of the rarest professionals work with us, Mr. Uttam. The reason is that he works with the deafblind population. It's a very rare population. We being people working with multiple disabilities should be knowing about it. Right, so the total number of deafblind population is 5 lakh. And they said that they have touched 80,000 people in the last 30 years. Yeah. Mr. Akhil Paul is another person who is also started the organization. So the fundamental question or the fundamental thing which he wanted to say is that, I'll start with this example, like if I ask you, how do you confirm that you are here? Can you with confirmation say that you are here in this room? Yes, how many of you say yes? All of you say yes, right? How? Why do you say that you are here? Because you see me, because you hear me, because you feel the touch, right? Because your joints give you some information. Imagine the major sources, the vision and the hearing goes off. Then it will be an existential crisis for all of us. Understood? It will be, whether we exist or not becomes a question for us. So that's the reason why Sir said that we should be looking at, okay, in his entire talk, half of the entire thing was mental health. He started with saying that deafblind population, a syndrome which affects is Usher syndrome, 3 types, type 1, type 2, type 3. We have hearing loss, slowly visual impairment comes in, or vice versa also comes in. We have Mr. Miranda here, we have Mr. Mahadevan here. You can have a look at them. Both of them are national awardees, fine? Which means that if you give proper amount of support to them, then they can go up in life. Rights of Persons with Disability Act. It is not Health Act. It is the right of the person to get accessible education, accessible infrastructure. So they work with that particular thing. The second thing which Sir said is that mental health is very important, and when you approach somebody, because the communication part is affected very much, it should be the tactile modality, the empathy which is there. We are not used to touch people. We are used to talk to people. We usually see people and hear people. So we should be learning how to give a safe touch. We should be learning what is correct. So for example, I am a deafblind person. Sir, how do you approach the person?
I will start from here so that you know that somebody is around rather than holding you. And then if you get attention, then slowly we can give hand. And it should be done as per your comfort rather than how to.
This is basic fundamentals. So if person with deafblindness, you touch somewhere here, rather than how are you. I still remember there was this Kalada Travels. The owner probably came in, and there was a deafblind person. He became so happy with the person that he hugged him, and I still remember that person didn't know what to do, how to do. So becoming happy and then hugging somebody is normal for us. But a deafblind person, the moment you are approaching the person, there has to be a systematic way. For all of this, you require empathy, you require an understanding, you require an attitude. And they are not people who are patients, remember. They are with a condition. They are people first. So the empathy, the style of communication, and the attitude can be cultivated with practice. It doesn't come like this. It's better we start focusing upon this dimension also, rather than focusing only upon the disease and the disorder. Correct? The second part, I told you, it becomes an existential issue. So for mental health, there are just 3 studies internationally available. Sense International was kind enough to create Samved. This is a checklist. Tell something about yourself.
Yeah, so basically it's a checklist which identify mental health needs of persons with deafblindness and multiple disabilities. So it's 2 parts. One is for child and one is for adult. With the obvious reason, I think we all understand that children has got different aspect, whereas adults have different aspect of it. And it covers basically 5 different dimensions where we look at their psychological well-being, their emotional well-being, physical well-being, communication aspect of it. And what we have tried to do that, because children with deafblindness or persons with deafblindness has got disability related characteristics. So how do we differentiate that this is because of disability or this is because of the mental health issues? So that's how we have tried to do through the checklist also.
Okay, so
Yeah.
thank you, sir,
Thank
for
you.
sparing
Thank
some
you, sir.
time.
Thank you very much
And
for-
thanks a lot. No, I wanted them to hear this, right? It needs to be felt somewhere here, and we begin the embodiment process. Fine, thank you.